Well, the results are in, and your condition is nothing major. However, we will be admitting you for surgery. It appears you've developed a peritoneal adhesion. So the peritoneum is a two-layered membrane that lines the walls of your abdominal cavity, and it covers your abdominal organs. Sometimes the organs adhere to the peritoneum, requiring surgery in order to separate these organs.
Even though he's my doctor and he's telling me my procedures and conditions, I don't know what he's saying most of the time. I mean, I know he's my doctor and I need to trust him, but how can I when there's such this disconnect between us?
One of the most important relationships we have is between ourselves and our doctor. And for the sake of our health, it's important for us to be able to communicate on the same level. Unfortunately, that doesn't always happen. Research into the communication between doctors and patients shows that 55% of adults in the United States don't actually trust their designated health professional. This is because of what is known as limited health literacy, which means that medical personnel can't always communicate the complexities of necessary surgeries or conditions. In fact, according to research published in 2016, 1/3 of all patients with a chronic disease find it hard to understand their own condition and the advice they receive from their doctor. Introducing Simetric, digitalized surgical demonstrations. We're a Houston-based organization trying to change the way doctors and surgeons talk to patients. Simetric is aiming to provide high-tech, easy-to-follow visual demonstrations of complex operations, with descriptions translated into 4 major languages, to simply explain the medical terminology so that patients and their loved ones can be confident about each health decision they make. By using advanced 3D modeling and animation technology, our application will be significantly more effective than word-of-mouth descriptions and more informative than paper pamphlets. In order to distribute our service, we're planning to partner with medical publication companies that have already been circulating educational print content to hospitals and physicians' offices. Let me introduce our team. Hai is our president and graphics director. Using his background in advertising, he's going to maintain the whole package of content that is released to the publishers. Veronica is our content chief of staff and will serve as a liaison between developers and our publishing partners to receive subject matter in need of breakdown. John is our 3D director. He'll work with our consulting team of nurses to create anatomically accurate models that doctors and patients can interact with and explore to come to an understanding of a particular condition or surgical procedure. Menelik, our motion media specialist, is an experienced videographer and will use his background in video production to oversee our animators. He helps to break down information into specific visuals and demonstrations. To present this technology to those who need it, we're asking for you to join us. In order to be a part of this monumental evolution, we are offering our investors 10% equity for every $100,000 invested. We provide the opportunity for advertising to our partners. We provide the opportunity to make a difference to you.